Welcome to the Interprofessional SPACe podcast, where the spirit of inquiry meets healthcare collaboration. In our podcast, we discuss all things interprofessional education. According to the World Health Organization, interprofessional education, or IPE, is when students from at least two healthcare professions learn about, from, and with each other to improve health outcomes and enable effective collaboration.
Welcome to the Interprofessional SPACe podcast, where the spirit of inquiry meets healthcare collaboration. I'm Susie Plows.
And I'm Ann Curtis. Today we're going to talk about our IPE journey as individuals and as a team. We'll have a little bit of a chat so you can get to know a little something about us and hopefully inspire you to join us for future episodes. So I'll go first, Susie. I'm a registered nurse, and my current role is Director of Interprofessional Education at Maine College of Health Professions. I work with a team here, and we provide IPE for all of our students. We have our two major programs at the college are nursing, registered nursing, and radiologic technology. And so I either create, develop, or help implement IPE for all of our students. So that's the short version of what I'm doing right now. What about you?
So I'm based out of the University of Nottingham. So I manage the Center for Interprofessional Education and Learning, otherwise known as CEAL, it sits in the Faculty of Medicine and Health Sciences, but also spans across other faculties. So we've got, I think, 15 different programs currently involved, but anywhere from medicine, nursing, midwifery, physiotherapy, all the way to pharmacy, social work, educational psychology has joined us for a couple of sessions this time too. So we're quite broad and have about 6,000 students a year that participate in our programs, so in our different educational outputs. I'm also on the board of CAPE, which is the Center for the Advancement of Interprofessional Education in the UK, and part of the communications working group for interprofessional.global.
Fantastic. I'm glad you brought that up because I wanted to also mention that I am part of the American Interprofessional Health Collaborative. So I wanted to make sure to give them a little bit of a shout out. So background, nursing, what is your professional sort of background?
Oh, right. So initially I studied anthropology and did a focus on kind of forensic anthropology, medical anthropology, but then moved into public health. So then did a master's in public health and a graduate certificate in health policy. So that's kind of my focus at that point before I started into interprofessional education.
So what brought you to IPE? Was there a moment or an event or a situation or?
Yeah, well, I moved to the UK in 2014 officially. And at that point, I thought I was going to do public health. But actually, due to kind of some visa regulations and different things like that, I had to find work in a different area. So it kind of ended up kind of stumbling into IPE. So I started looking at universities. I did work at Ohio University previously, and I loved it. And I thought I'd quite like to get back to university if I can't do public health. So ended up finding a description for a job in interprofessional education. I thought that sounds like right up my alley. I think having a background in public health, getting healthcare professionals to work together, it was like, well, that's a no-brainer. Of course you need to be doing that. Didn't realize how siloed all the different programs were and professional bodies and everything. So it's been a real actual joy, and I ended up loving it. I thought, this is kind of what I'm meant to do. So sort of stumbled upon it. I guess it was a bit of a, serendipitous, I'd say. So, but nice. What about you? What brought you to IP?
So I ended up in one of the courses that I took, had to develop and facilitate a project. And I ended up doing an interprofessional pilot program with 2 nursing students and 2 med students. And it was fascinating to hear, as a nurse, to hear the med students say, wow, I had no idea that nurses do such a thorough assessment. And to see the nursing students sort of learn by interacting with those med students. And it was a little bit of a light bulb moment. The more I learned about IPE, I think you used the phrase no brainer. I just we need to be doing this. We absolutely need to be doing this. So that was the focus of my doctoral capstone project, IPE. And here at Maine College of Health Professions, we have 2 major programs, and World Health Organization says that's all you need, right? They can learn with, from, and about each other. And from then on, that's just been the area that I've focused on is IPE. And I love that you use the word joy, because I get a great amount of satisfaction out of doing this work. It's what I'm supposed to be doing.
Yeah.
Yeah.
So I know we started working together, let's say it's been a year and a half?
Yeah, maybe
2 years?
not very long.
No,
No, I don't think it's been 2 years yet.
No, it's been 2 years.
No.
So do you want to share with everybody how we got started working together?
Yeah, of course. It was through LinkedIn, right? I think we both were doing our IPE things separately, and I like that platform because you get to see so many people's contributions. And you reached out to me and just linked, and we got talking. And I had been thinking here and talking with folks here about doing an international event. And when you and I linked, I said, absolutely, yes, we should talk about doing something together. And it exploded. It did.
Yeah. No, it did. And I think, initially I was a bit like, oh gosh, this is going to be really hard to do. And I think what we ended up finding out was, well, we worked well together. I think that was nice because we kind of clicked. But we made it, I think, as easy as it possibly could have been. There were definitely some bumps along the way, but I think we gave each other some space, a bit of grace, and like knowing how difficult it is. I think normally when you're already have kind of a packed schedule and you really want to do something extra that you think is going to be really beneficial for the students, but it's like, how do I fit this in?
Yeah, and I think so. We do have plans to talk about that particular IPE event for one of our episodes, but yeah, it was really exciting, and it was fun to watch. The students were so excited to be able to talk to somebody, from another country. They were really excited about that. And that first session, we did that first session, we ran it again, and we have some plans to kind of continue.
And like so we'll talk about it in the future, but our session was an online session with our students. So we had not students from Nottingham and students from Maine, and that was it was such a great session, but it was a little one. But then after that you came to visit, because we thought we want to do more than this, don't we?
Yeah, that was so much fun. That was fun. You need to come here at some point, right?
Yeah,
not in the winter, but
no, but that was a blast, because then we really got to like actually be together in person and say, well, how is this going to work, and how are we going to make this happen? And that was
right. Where do we want it to go?
Yeah, where do we want it to go? What do we want to do? And then we went to Nexus together. We did. That's when we then kind of formally were like, okay, we're going to make this more of a partnership officially. And then we started doing things like this, where we thought, okay, we want to. What do we want to see? Where are some gaps, and what do we want to be?
Right. So I have a little bit of a drive to and from work, and one of the things I like to do is listen to podcasts. And so I started doing searches for podcasts about interprofessional education, and I wasn't finding a whole lot. And then you and I got talking. I've always wanted to do a podcast, and so intimidated as I am, I love talking about IPE. I love the idea that we'll be able to share what's happening, what's current, and pull in other individuals who want to share their perspectives. Because one of the things I really love about IPE is how everybody sees it as the path that we need to be on. And people are so willing to share, right? So willing to help you problem solve. Oh, here's one way that I got around that, or manage this challenge. Because right, we all know interprofessional education has a lot of logistical challenges. So I'm really excited to be doing this with you.
Yeah, absolutely. I am too. And I think like you, I love podcasts. So I'm hoping that this will be a fun thing and then everybody will enjoy it and we can share stuff. I think what I've also found with interprofessional education is that while it is all about collaboration, I think those that are just doing it, a lot of times interprofessional education is sort of a side area for people that are focused on something else. I think for those of us that do interprofessional education more full time, or those that are trying to start it off or whatever, I think it can sometimes be quite isolating. But I think going to conferences or meeting people through different organizations has been a really great way to find like-minded people that really want to collaborate, want to share, and are open and have a passion for IPE. And I'm really hoping that this will help us to bring people together as we talk and as we have guests on that we interview, and we can go through some of the best practices of IPE and how to implement it and how to evaluate it and how to, everything. So yeah, it's good.
Yeah.
It's exciting.
So it is exciting. I wanted to ask you to kind of explain. So our title, Interprofessional SPACe, it's got our initials in there, Susie Plows and Curtis. But when we were talking about what to name it, you're eloquent, I thought, about using that the word space. Can you talk about that a little bit?
I don't know if I can remember it.
I put you on the spot. I put you on the spot. Well, let me tell you what I remember. I remember you saying that it kind of, what you said just a few minutes ago reminded me. You talked about how everybody's curricula are already so jam-packed, right, with really important profession-specific knowledge and skills, so that it took, you needed to be deliberate about creating space for IPE to happen, not just a physical space, or a space within a curriculum, but creating that space as students kind of grow into their profession to develop those interprofessional skills, those collaborative skills.
Good.
Yeah, well, you said it. I was just repeating what you had said, but that really struck me because it has to be something it just doesn't happen by itself. It takes effort, and it takes certainly planning, but starting with that mindset of this is important. We are going to create space to make this happen.
And honestly, and that's what we have to do too in developing our, talk about the curriculum, but in developing like our colleagues and everything as well. Because I think even once you're as a professional, and even people that we have to come in to facilitate or to help teach or whatever, we're always kind of developing, I think, too, as interprofessional kind of beings, and how to be better at collaborative practice and how to make it work better. I think even in our journey together, it's sort of like, okay, well, how do we be better about this, or how do we kind of allow for the growth process, I guess, too, because that's very much in there, and like constantly trying to get better at what we're doing, because that, I think we both are, not to be like big us up or whatever, I think we already do IP quite well though, but I think there's still so much more that we want to do. And I think we've talked a little bit about that. I think for your program, you already got quite a lot, but what would be for main college health professions, what's your ideal? If you could do like an ideal kind of, I guess, share where we want to be going with our stuff, what would be your ideal for your students and what you see happening with IPE in your center? Where are you going?
Sure. So currently we have IPE in every semester. I most recently been really excited that we have enough events now that we can offer options. That's not how it started. And one of the things that we've done most recently is a foot care clinic at a drop-in center for people experiencing homelessness. And we've done it a couple times so far. And really it's been just washing people's feet, and talking to people. And what I would love to see happen is to have that expand and grow to include more healthcare profession students, more resources for the guests who visit. And wouldn't it be great if that could become a standing clinic that students could work collaboratively and professionally while providing important care to people who need it? I think that would be exciting. I'd be really proud to be part of something like that. Yeah. How about you? What do you have like a big...
Well, I think the community stuff's so vital, and I think so. What you brought up, I think it's like that's just especially where we are, like in our time, it's like just bringing people together, isn't it? And that's part of what we do anyway. And it's like we need to bring in the patients, connect with communities. I think we talk about that time and again. When we meet, how do we bring in the patients more? How do we,
Yes.
I think for us, we have embedded into 3 years. We do an interprofessional kind of core curriculum, like in a day that they have together. And then we offer lots of optional things that they can attend. But I would really like to do, I think, more kind of what you're doing and saying, okay, part of just embedded across the curriculum and say, okay, but in order to pass this module, you need to do all these different things. And it's more of a separate standalone module that's not embedded in other modules. You know what I mean? So we have a 0 credit module, but it's embedded within modules that are already happening in the different professions. So it would show up kind of as a day in that module, but it's not its own separate thing. And I would quite like to have something like that. But now with the number of programs we have and the amount of students and everything, it just gets really complicated. So, but it would allow us then to also dive deeper into the sub-competencies of making sure with the kind of core competencies of IPEC, which we will talk about at a later session, but that underpins all the stuff that we do at Nottingham. But it would then allow us to help kind of map out the students and look at their progress a bit more detailed. So right now it's all very optional, except for kind of our core curriculum. But that to me isn't, I think we want more. We want more. But it's we've got a center, but and we're very well supported by the programs that we have with academic leads from all those and through clinical skills we work closely with. But our own center, it's just myself and a part-time administrator. So, so that's where we're, we're kind of at capacity. But it's like trying to figure out how to do more, how to do more with less, or how to be more efficient. And that's always, I feel like, kind of the struggle at how you deliver this as best as you can, given your limited resources.
Right. So. And I think kind of maybe a summary or similarities that we're looking at is how do we make IPE, how do we help students understand, and faculty, frankly, although the faculty here is incredibly on board with IPE and leadership as well, which is really important. But how do we help students to see that it is as important as their profession-specific work? Right? So that they don't see this as an extra thing that we have to do and tick off the box, but how do we provide them with meaningful evidence-based activities and help the students to see that value of it's not an extra thing. It is important. It is part of my curriculum.
Yeah.
Which I think is a challenge. Do you have honors? So we have IPE honors. Students can go above, beyond the requirements. I think I said this earlier, they have to do IPE every semester. But we also have the ability of students to do extra and creating a portfolio at the end, and they're able to graduate with IPE honors. And we're actually starting to see some employers ask about IPE when they're interviewing. Do you guys have anything sort of like that?
Well, we have this thing called the Nottingham Advantage Award, and they complete 30 hours, then it ends up going on their transcript. So they've done that, and they can have, so we have 2 IPE modules on that they can complete, one around
Nice.
teamwork, and then one around different master classes that we run. So they can say, okay, yeah, I've done those and focused on interprofessional working and collaborative practice. We
Nice.
we have, and that is actually multidisciplinary. So we have students participating in that from law and different social sciences and, areas as well, coming in and saying, okay, actually, I want to work though in kind of adjacent to healthcare or within the scope of what healthcare is covering. So, engineering and things like that, human factors plays a big part in when they're designing things. So, that's quite interesting and fun, but yeah, we don't have that many. I mean, this year we've got, I think, about 20 students participating in that. So it's not very small. So what's your uptake like for the IP honors?
This year is, I think we're looking at like 5 students who are actively working on earning IPE honors, which for us is a lot. We have like 250 students, so for us that's a pretty good number. That's the most we've ever had.
Yeah, I think that's great. I think it's a great idea to do it.
Yeah.
So that's it for this episode.
Before we do sign off, we want to remind you, whether you are a student, a practitioner, or an educator, that the work you do is incredibly important and it can be very stressful. So we want to remind you, you are not alone. Please take care of yourself, and we hope you can join us again soon.